We got the news this morning and we're all shocked because we saw him on TV just a couple of weeks ago. Country music icon Toby Keith, known for his hits including Should Have Been a Cowboy and Road Solo Cup, died peacefully in his sleep at the age of 62 overnight. He died after a 2-year battle with stomach cancer. Joining me on the morning show, my friend and a bariatric surgeon and specialist in the field, Dr. Husain Abbas with HCA Memorial Hospital. Good morning.
Good morning. Good to be with you, Bruce.
Yeah, doing well. Stomach cancer, it's also known as gastric cancer. What are some of the warning signs and symptoms that you might have a problem?
So, one of the problems with gastric cancer, as you said, is that there really aren't any significant signs and symptoms. Their symptoms and signs are very vague. So things like feeling of fullness, losing weight and not knowing why, having nausea, vomiting, or having long-standing burning sensation, for example, in the upper part of your abdomen, or having reflux for a prolonged period of time, those could be warning signs that something is going on within either your esophagus or your stomach, actually. So you definitely need to seek help and seek medical attention for those.
How common is it, and who does it most affect?
So it's not very common, but unfortunately, it is fairly deadly. And, it does affect, there's some things that are obviously in your control and some things that are not in your control. We know that people who have low fruit and vegetable diets have a higher incidence of gastric cancer. Smokers have a higher incidence of gastric cancer. People who consume too much alcohol have a higher incidence of gastric cancer. And also, for example, in the Far East, where a specific type of preservatives are used, that can also raise the incidence of gastric cancer. And other things are genetics. So while the genetics are not something that you can control, definitely your food, your diet, your healthy activities are definitely things that you can modulate and change to try and decrease your chance of gastric cancer.
So you get that diagnosis. What questions should you be asking the doctor?
So the first thing you need to know is, what stage do I have? And that needs to be staged, because depending on the stage of the gastric cancer. So if you look at it, really, if you think of the wall of the stomach, see how deep is that tumor going in. The deeper it goes, the more likely it has the ability to actually spread outside of that field and go into the lymph nodes. So that will then determine how are you going to proceed with surgery. Of course, imaging studies are done, like a CT scan of your chest, of your abdomen, and the pelvis, to make sure that that tumor has not gone elsewhere, for example, to the liver. In that case, what we call, unfortunately, metastatic disease.
So that leads me to the next question about management and treatment, and is it curable?
So if it's caught early, 50% of people are cured. But here's a challenge. If it's caught early, most of the time we actually diagnose gastric cancer incidentally. So and usually it's diagnosed on endoscopy, where we can catch it early on before it's actually has metastasized. So somebody comes in for completely different symptoms, maybe have mild reflux, but a gastroenterologist performs an endoscopy, an upper endoscopy known as EGD, and they get a tissue of that, and then they confirm diagnosis of gastric cancer. If it's caught early, then, as I said, 50% are cured. Unfortunately, only 1 to 2 in 10 people are actually found to have early gastric cancer. Right. So if it's found later, then you probably need to have chemotherapy on front, and then followed by potentially surgery plus and minus radiation therapy.
So if they find it after it's been around for a while, what are the chances of survivability? It's
very poor. Unfortunately, it's very, very poor. Even though with what we call a lot of times curative resection, so even though you removed all the cancer, the chances of that tumor going distant, as in going into the liver or showing up a couple of years or a year later or 9 months later into the lungs, into the liver, it's pretty high. So in that case, survivability or complete cure is fairly low, especially at about 5-year mark.
You mentioned that there are some genetic things that we don't have control over. Are there some lifestyle things that we can do to try and avoid gastric cancer?
Absolutely. I think those are the keys. You can definitely lower your risk of gastric cancer. Number one is increase your diet with fruit and vegetable. Very important. Avoid smoking in any form, whether it's vaping, whether it's actually, I guess, the old-fashioned cigarettes, cigars, those you have to avoid. Sometimes if you have an infection usually what's called an H. pylori infection, that could be simply cured with antibiotics, and that will take care of that. Watch your weight and stay an active, healthy life. Avoid high fatty meals. All of these have actually been shown that potentially could increase your risk of gastric cancer.
Dr. Husain Abbas. Some good advice and just basically healthy lifestyle choices that you can make that can make a big difference when it comes to gastric cancer, other cancers, and other problems in your life. Appreciate your time early on this Tuesday morning.
Thank you.
Have a great day, my friend. We'll be right back.
Me too.